Alrighty, with the rhinoplasty, we usually see you on post-op day 4 or 5, not immediately after surgery. The reason we don't see you right away is if you're not up walking, that's okay. I usually make my other patients come in early just so I know they're walking. But with a rhinoplasty, if you're chilling out and watching some TV and hanging out, that's quite all right. What I really want in that initial post-op period is for you to be calm and relaxing. With a rhinoplasty, one of the few complications we can have is bleeding. We want to make sure we reduce that complication as much as possible. So we want your head up, elevated, and you being very calm and relaxing, and that's what's going to ensure that you don't have any post-operative bleeding. You will have a splint on your nose post-op and some tape on your nose post-op, and in some circumstances, depending on what we did on the inside of your nose, you could even have nasal packing, although that's not the norm. But if we have done work to try and help your breathing because you've had breathing obstruction or septal work, you may have packing in your nose. When you come back to see us on day 4, we'll remove that packing if you have it. We will also remove your stitches that are at the bottom of your nose and that little spot that I told you you'd have an incision. And we're gonna remove your splint and your tape, and we're gonna look at your nose. Sometimes there's minor adjustments I want to make to your nose at that point. That does not mean we're going back to surgery. It just means I'm going to make small splint and taping adjustments. This shouldn't be anything that's a big deal or causes you any stress or problems. It just allows us to look at it initially, and before the bones and everything are totally set, we can make minor adjustments like squeezing the splint a tiny bit tighter to make things a little bit narrow, or even expanding a little bit to take away a little bit of the pressure on your nose to get things exactly as we want them now that we can see your nose without much swelling. We will put the splint and tape back on your nose at that time for another 4 to 5 days, so you'll wear your rhinoplasty splint for a total of 8 to 10 days. When you come back to see us at 8 to 10 days, it will be removed. You won't need that anymore, and you'll just need to be careful about playing any sports where you could come in contact with things like a ball or somebody else's hand or somebody else's head. So basketball, volleyball, soccer, those would be things we wouldn't want you to do for the next 3 months. Otherwise, resuming exercise at 3 weeks would be normal and appropriate and would not be any problem, as long as that exercise is not a contact type sport where you could get injured. We tend to see you back after that at usually 4 months and then 8 months after surgery, and then you're good to go. At that point, your nose should be pretty much exactly the way it's going to stay. Again, if you have any questions or any problems or concerns during those windows of time we're not normally seeing you, please call us. Please let us know. Please alert us right away if you think there's any problem that we need to address.